what the hell would I do if I had logged into a platform this morning and I found out I will have Alzheimer in 5 years from now? And that sort of shifted the whole mentality of ixlayer and understanding how sensitive and how important it is we are delivering health data that can affect individuals' life.
There are moments when the future comes into view not as speculation, but as responsibility. For our guest today, that moment didn't happen on a launch pad, despite his background as an aerospace engineer. It happened in front of a dashboard. Pouria Sanae, well, he saw the future in a single pixel. A 37-year-old patient with a near certain genetic risk of early onset Alzheimer's. Same age, same decade of life, and in that instant, the order of the universe shifted. Pouria realized that our current health system is built for the aftermath, not the anticipation. We wait for the check engine light to turn on before we even think about checking the oil. We treat the human journey as a series of disconnected islands, symptoms, doctors, labs, prescriptions, with no bridges between them. But what if we could redesign that architecture? Pouria Sanae is the CEO and co-founder of ixlayer, a platform that is quietly rebuilding the infrastructure of modern healthcare. He is a systems thinker who pivoted from rocket science to the source code of humanity, driven by a mission to return fragmented data into a continuous life-saving loop. In today's conversation, we'll explore the concept of the pre-patient, a world where DNA, AI, and diagnostics work together to catch disease before it declares itself. We discuss why normal ranges are a statistical lie, why 99% of patients get lost in the friction of the system, and why the most important technology of the next decade isn't a new drug, it's the infrastructure that delivers it. This is not just a story about logistics, it's a story about becoming the kind of people who refuse to wait for tomorrow. Welcome to this episode of the DNA of Things. All right, Pouria Sanae is a visionary builder at the frontier of health tech, precision diagnostics and human-centered healthcare. Trained as an aerospace engineer and former rocket scientist, he blends systems-level thinking with a deep commitment to transforming patient journeys. After early work in data mining and product innovation across Yahoo, Flickr, and e-commerce startups, he entered the genomics world as head of product partnerships at Helix, launching more than 20 consumer DNA products. Now, today, as the co-founder and CEO of ixlayer, he leads a platform that integrates labs, clinicians, payers, and patients into a seamless direct-to-patient experience across cardiology, oncology, Alzheimer's, endocrinology, and more. His mission is to shorten the gap between symptoms testing, diagnosis, and treatment. And so what a pleasure it is to have this change maker on the show today. Pouria, thank you so much for joining me on DNA of Things.
Well, thanks for having me. I'm excited, Jeremy.
You know, as I read the bio that I co-authored with our friend Chat, I'm not sure which chat I use. I will say I've built my own LLM as a result of this show to kind of guide it into, well, with my own language and in my own words, so to speak. But in my own words, as I read the intro, I remember now back to this time with Helix, the direct-to-consumer product launch, and I remember having multiple meetings with your team back in the day. And now Helix itself has pivoted quite significantly today, more focused on population genomics, but that's a big shift, like for you. So that would have been, I guess, what, in 2017, 2018 when Helix did that?
Yeah, I joined them, I think, 2016. I joined them very, very early, one of the early team members, and far before the launch. And just getting that platform off the door was an achievement of its own.
Oh, yeah.
It's a little bit shame. I mean, I have a lot of respect for the founders over there and what they were trying to achieve. We will have a version of that at some point in the future, maybe a little bit early for its time. But yeah, Helix was fascinating. It still is. Like, the reason I joined Helix was DNA, the software of human, the software of ourselves, just knowing your own code. It's like AI reading its own source code. So yeah, it's always fascinated me.
Well, that was quite a team. I mean, it was Rob Thurston, right? Of like MyFitnessPal. Was he the CEO? Am I getting
He
that?
was
Rob
there for a
Thurston?
while. Yeah, Justin and James, the founders, was there. David Yu, chief product officer. Yeah, it's a great team.
What was the Facebook guy's name? I remember I had quite a few conversations with him, gapping on his name.
On the BD side, or
Yeah, BD.
Sunny?
That sounds right. Yeah.
Yeah.
Yeah, it was a stacked team. It really, took up the industry. I remember like Affymetrix responding in kind. It solidified my partnership with them because I already had a relationship, and they since have been acquired by Thermo Fisher. But even 23andMe was fast following, right? And they were trying to start their own app store, so to speak. And yeah, I mean, there's nothing like an idea whose time has come, and I think we're on the precipice of that, with AI but for me, the thing that is quite fascinating is your jump into this out of aerospace engineering and systems thinking, and you never turned back, right? Because even though Helix pivoted and it didn't achieve the specific goal that it set out to, I would say it is well on its way of achieving, I think, maybe the bigger North Star that was going to be associated with that in the population genetic side of things. But you've stayed in, personal health, and that's really, ixlayer, right? So maybe you can walk me through that journey of rocket science, to precision medicine. How does that happen?
I mean, I think one more word that comes to my mind is just curiosity. Like I'm a little bit overly curious individual, and I started my career in rocket science. My education and background did 7-8 years for Airbus and ESA, European Space Agency. Grew up in Sweden, and then there's a big step between rocket science and Helix. Had two startups in between there, not in healthcare, outside of healthcare, in e-commerce data mining and sort of prediction algorithm. They would call it sort of a ML these days for e-commerce back in Sweden. So two startups. And then I joined forces at Yahoo Flickr for a while as well. And when Helix knocked on, I got introduced. So the guy that actually hired me to Yahoo was the same guy that hired me to Helix. And he's like, you have to come over here. And at that point, I was sick and tired of a corporate job. Even though the pay was good, it was just like, what the hell am I doing? I'm selling digital ad space. That's in the end, I'm selling billboards online. That's what I'm doing in the end of the day, right? If you strip down all of the so-called tech, that's what the value you add to the world. And is that why I study all those years to sell this digital ad space? And then during the same time, my mom was just found out that she had cancer. So I was sort of rethinking life. And what fascinated me with Helix was it was in healthcare, it's precision medicine, but it was also in software of us humans, the DNA, the code, the source code, right? Really. And so the transition was a no-brainer. I remember I studied so much prior to the Helix interview. Like I knew that they wanted me. I have no idea why they wanted me. Later I found out it's because of the experience of a large cloud system and data system that aerospace have, Flickr definitely had with large files, videos, and so on, and genomics and precision medicine has with DNA files. So but prior to that, I was like reading every single book. Didn't know what to read, so I was just consuming so much information. I'm like, I really want to get into this company. This is the future. So that's sort of a little bit the transition.
Yeah, well, and then you never look back because even though Helix pivoted, I mean, ixlayer has been through its own journey as well. Because I think you had a version of, I don't know if you'd call it a 2.0 version of Helix initially, but you've taken some twists and turns to get to where you are now. So how did that all unfold?
Yeah, so When I was at Helix, we launched as part of this app store, we launched multiple products, both for startups and for larger health system, population health program, and so on. I mean, companies such as Mayo, Geisinger, Invitae, National Geographic was in there, and so on. And it was very obvious that they are rebuilding the same wheel over and over. Every single organization was rebuilding it on top of Helix. So, and what they were rebuilding was a cloud that is connected to the lab and a patient journey. So I started sort of brainstorming the idea of ixlayer with my co-founder, who at that time was at Illumina, and he was seeing the same thing over there. And we called it initially, it was IX, infrastructure and patient experience. And we added the word layer because I had to, quit my job at Helix, go back, tell them, hey, I'm not competing with you guys. This is not a Helix. This is a layer on top of it. Please don't sue me and partner up with me. And I mean, the founders they have such a good heart, both of them. So they became the entry gateway to precision medicine and to our first customers. They became the first lab. We got our first customer through them. The absolute first test that we launched was on APOE Alzheimer test, which kicks things off, but still today, the name has stuck and the mission is the same. I and the X, the infrastructure and the patient experience layer. We've done patient journeys for precision medicine, for pharmacy, for health insurance and payers, and today for pharma. So the concept is more or less the same. New modules, new functionalities.
In a much, I think, more kind of, would you call it, direct outcome that you're driving toward, at least, today, in accordance with our last conversation, where connecting the patient to the solution, to the cure, to the medicine, right? So I do want to talk a little bit about, maybe before we get to that, the different iterations. So you are now this diagnostic enabler in the beginning, right? With the initial proof of concept, and you've now moved into the, from the insight, from the diagnosis to the insight to the action to take for better health. But it didn't happen right away, right? Like I think there was like COVID kind of jumbled some things in the middle there, and so how did that kind of direct you?
Yeah, there was a lot of things that happened in the middle there. So we didn't really know, and we weren't really thinking about it this way. But in the end of the day, ixlayer is a platform that takes a patient from, let's say, A to C or to D. So let's take patients through a couple of clinical journey steps. That's what it in the end does. And these steps can be very different based on the patient and the clinical protocol. For precision medicine, it was getting the sample collected, so at-home sample collection, getting a genetic counselor involved, processing the sample, storing large-scale DNA data, and compiling it into an understandable. That was the journey. Hey, how can I go from my saliva to our reports? And what is the steps that is needed for that? I remember and in between, I started realizing how sensitive and how important the platform is. So when we did our absolute first customer, ADX, which is an Alzheimer clinic, I was looking at the data through our admin portal, and I was looking at some of the breakdown, and I found out that there was an individual, age 37, that through our platform had found out that they had, with a high probability of 93 or 95%, they will have an Alzheimer age 45. And I was around the same age myself. I'm like, what the hell would I do if I had logged into a platform this morning and I found out I will have Alzheimer in 5 years from now? And that sort of shifted the whole mentality of ixlayer and understanding how sensitive and how important it is. We are delivering health data that can affect individuals' life. And I used to use that for us, if you look at our data chart, that individual is a single pixel in a chart. Like if you don't zoom into that individual, you wouldn't even see it. And I used to use that single pixel for all of our interviews in the early days, or onboarding sessions in the early days. So every team member that joined us understood that, hey, we're not building this platform for every other pixel. We're only building it for that individual, and that's the patient that we're targeting. So patient journey, patient comfort, patient, care became very important very early on. And to be honest, primarily for that single pixel, it was sort of a wake-up call for me. And then through the journey, we did Alzheimer, ApoE, pharmacogenomic, newborn screening, carrier screening, expanded into the other spaces. I realized that, hey, there's a whole world outside of genomics and precision medicine that is so much bigger and that is so much easier because they don't deal with large scale data. And so we ended up branching out to heart health, new labs, new telehealth networks, and so on, to endocrinology. And then we were establishing a partnership with Ambry Genetics. I think we're down in San Diego, early COVID days where nobody thought this thing is going to come to US. Right, this is something that was overseas, and our CTO reached out, sitting in a hotel, and he's like, "Look, if this COVID's going to come, nobody's going to leave their home. Everybody's going to do their testing at home, and we have everything to support that because that's how we work today. We should try to get ahead of this." And our first initial reaction was, this is never going to come here. This is going to be gone in 2 weeks. But then we looked at it a little bit and we realized, like, hey, yeah, we have everything in place. Started to piloting out a small program without having a single customer at that point. And then 2 months later, boom, it's just exploding. We did 1,100 programs during COVID, 90,000 patients per day, Department of Defense programs. We did all of the United States Coast Guard's COVID testing, which was its own challenge because if we were delayed with a lab test, they couldn't enter their facility. They couldn't go to their jobs, basically. And working in sort of that whole military setting was quite interesting too, having all that whole mindset that, hey, this is really good. Time is very, very important. So long story short, very small team, a 20-man team that used to do 90,000 tests per day. I mean, still today it's unbelievable. And that stress tested the hell out of our system. That sort of forced us to grow up and start acting on a large scale volume, large scale programs and so on. And then post-COVID is a whole other story post that. But definitely an interesting journey that I don't think I will ever experience again. I don't think anybody's going to. I hope we won't experience that again.
So you come to the other side of that, and now you're integrating with like 40 plus vendors, almost 30 labs. You have, so is the ixlayer now facilitating those vendors and those, like, so I think about like a Function Health, for example, right? They're in the news a lot nowadays, and it's about, at home testing. And I think I read a report, it was like 50 million blood tests in 18 months or something like that. Yeah. And I think that's just bloods. And yours is, if I'm reading between the lines, I think you are like laboratory agnostic. Is that true?
Yeah, we're clinical service agnostic. So,
and you're strictly focused on clinical, whereas Function really isn't clinical, right? It's really more wellness.
Correct.
Yeah. For now. Yeah.
And it's hard to draw the line between what is wellness and what is clinical, I guess.
It sure is. Yeah. So the vendors then that work with you today, so this is now realizing like the vision of the ixlayer, right? So what do those services look like now across clinical health?
So the vendors itself, the way I sort of envision us is this platform that connects the vendors together I don't know, some of our investors calls us a combination between Shopify and Stripe. So Shopify on the type is the patient experience that can support any clinical protocol. And the Stripe is connection to banks. Instead of being connected to financial systems, we're connected into clinical services. We enable a program that for the patient need to jump between multiple clinical services. So in a normal setting, you go and you visit your doctor, then you go to LabCorp and Quest. You might need to come back to your doctor. You then might need to go to a specialist, and then you go to pharmacy. That's your normal. All right. If you want to do that digitally, you have to go and create, in this scenario, 4 or 5 accounts. You have to download data and upload data, download the lab test, upload the lab test. You then need to do it in an order so that you bring back that to the first system. So it's a very complicated thing that you need to orchestrate. And that's how we glue all of these systems together, allow the patient to just walk through the whole journey as it was an Amazon checkout. The patient doesn't see ixlayer anywhere. It's always branded under our customer's brand. So post-COVID, couple of interesting programs. We did majority of the lab testing for CVS. So if you went into CVS and you picked up a kit branded CVS, this could be a H1D, this could be a HIV or any type of kit. Everything minus the logo was ixlayer. Everything from integrations to the lab that supports it, the kitting and fulfillment, the figuring out the logistic deals of it, how fast do the shipment need to go back to it, the ordering physician. So the entire package was ixlayer. Below ixlayer, going back to the Helix day, there was a lab for HIV. There was a lab for A1C. There was a specific telehealth provider for that therapeutic area, and then connection to other services that is needed. And sometimes this is connected to EHRs and the data can go back to the EHR. Sometimes it's just patient facing. A patient goes through this journey.
And so then when we use the word vendor, are these clinics?
So we use the words, vendor to us means a clinical service. And not necessarily a clinic, but a lab, or telehealth, a doctor, or a pharmacy. In some cases, it's like a insurance and benefit management system and so forth. Our customer becomes the program owner. And a program owner, in my first example, CVS would be a program owner. So that's a pharmacy. We, right now, one of our larger customers is LA Care. They're a payer health insurance company in the LA regions, where they do a lot of gaps in care programs for their members. And they're the program owner, which is the customer. And then, of course, we do ton in pharma, where biopharma customers such as Sanofi, AstraZeneca, and so on, they are the program owners.
Got it. And so then you bring not only the ixlayer, but the relationships with the other labs, for example.
Correct. We bring the whole ecosystem connected and ready to go. Sometimes fully contracted with us, sometimes directly contract with the program owner, which is our customers as well. And the beauty of it is that we don't have a margin on volume. So we don't charge a margin on the test that goes to the lab. We charge our customers a SaaS technology platform fee, which is very visible, paid by the customer. And in many cases, the patient or their insurance is paying for the clinical services. And that way we check the box from a regulatory point of view. We check the box from a competitive point of view. We're driving volume to our vendors. So we're adding value to both sides of the chain.
Yeah. Well, you've amortized a lot of that startup cost, right? In a world where it's not covered by health insurance and it's driven by economies of scale and volume, like in Helix, they were trying to amortize based on forecasted sales of apps or subscriptions, right? Because back then, I think whole genome was still over $1,000, but you guys were selling it for, or Helix was selling it for, I can't remember, $399 or less. Yeah, but that was essentially selling at a loss because you're expected to recoup the downstream analysis. Now, in this instance, you've built the ecosystem so that you've already proven that you have economies of scale, and so you know smaller, let's say, unproven program owners can benefit from that infrastructure. Is that the right way to think about it?
Yeah, that's a good way of thinking about it. And also that a big program owner, so let's say if we're using one single lab, you might connect a big program owner such as CVS to that lab, and you might be using a small startup to that lab. We're getting a discounted price for
Everybody.
the sum, yeah.
Yeah.
So the smaller startup will benefit from it too, correct.
Right, right. So you're like decreasing the barrier to entry for innovation or people with innovative to diagnostics.
Correct.
Interesting. Yeah. And so in so far as the suite of tests that you provide, is that still includes, genetics and bloods and
Yeah, we're at this point agnostic to the test. So we have, and we're also agnostic to type of test. We call it multimodal lab testing. So we're fully integrated to LabCorp and Quest. So we can provide patient service center lab testing. We have integrations with in-home mobile phlebotomies. So we can provide in-home care for home blood draw. And then through our partnership with not just labs, but sample collection devices, the YourBio, the Tassos, the Red Drops of the world, we can cover self-collect at home testing as well.
Got it. Yeah. And then what about because the labs are going to report on the models of the day, right? What about this idea of, so I mean, like published models that are clinically validated, let's say, but like moving into the realm of evidence-based, now we're kind of on like frontier, like say like rare disease, where, obviously like the FDA approvals they're not as stringent because the populations are so small and you're not going to get the efficacy because you're just not going to get the numbers. So that's one instance of a model that's evolving at like, the speed of research, the speed of thought. And so I'm imagining now like kind of open source models and say less diagnostic now and more say still health predictive, like a PRS, right? Like there's a like PRS catalog, for example. It's like 5,000 plus different models that have been published. Okay, so maybe 100 of those are usable. And then what's interesting is like how do you, as the care provider, kind of stack those models that is unique to the kind of solution that you're delivering, whether it be say rare disease or cognitive decline or heart health. Have you seen any movement there in terms of model stacking on the digital side and frameworks existing to facilitate like a quicker speed of deployment in that world? Like, so think of like kind of the app store that Helix was doing, but like at a much bigger kind of frontier research led basic science frontier, but then there's a clinician frontier. And then there's the kind of the commercial kind of gap that you've got to cross as well. Are you seeing anything, there in terms of innovation? And so the reason I ask is I had Sean Gibbons, who's at ISV, on the show a month ago or so, and he was actually sharing his gut health model, where he's built this like predictive algorithm based on the kinds of microbes that live in your gut and the short chain fatty acid profile that you're presenting with, as well as measured by like a fecal sample. And then based on that information, you're given, say, a supplement protocol, to affect to affect this issue of dysbiosis in the gut, which we know is correlating with say, stress, mental health issues, or obesity or systemic inflammation. And the point is he's, building that model today, and there are many other hundreds or thousands of models like that being developed. And so what he was showing was, it was really interesting because I said, hey, this was work that I was doing in my postdoc, because the work I did was the N of one first case study of how the human gut is colonized through infant, the
Yeah.
infant gut. And I said, because, we did that in, it's like 2008 or nine when we published that. And he's like, what's that? He's like, yeah, about 17 years. He's like, yeah, that's about the time that it takes to go from like basic research discovery to clinical validation and implementation. And so in everything that's changed in the last few years, you can imagine a very real scenario where that's like, to say that we could do that in 17 months is not a far cry. And then, again, depending on participants and validation, it can go even faster. So what are your thoughts on that kind of, I know it's outside of the scope of where you're at, but I'm thinking about.
Yeah. So our primarily focus area today is life science and biopharma. And we keep an eye on the lab testing side. We keep an eye on everything new that is coming out, all of the models or of the new lab tests or the formats that could potentially identify a patient earlier. We put them into two different buckets. One is screening a patient and identifying this patient as a high risk individual. The second one is full-on diagnostic, right? So if you divide these two, they're all lab tests from models. I think our programs are using that is primarily for screening them. And if we can manage to screen them and just say, hey, this person has an elevated risk, that itself has a great value, because then you can send them into a specialist with that information. A lot of the work today is in commercial pharma. So within commercial pharma, we divide the journey into three parts: pre-prescription, prescription to first dose, and post-prescription. Around, a couple of years ago, this whole pre-prescription started to bubbling up. Today, there's a lot happening there. How can you help, or there's a word we use internally called pre-patient. How can you help screen and identify a patient before it's late, right? I have a little slide that I use for internal all-hand meetings where how can we make sure that we check the oil before the engine light goes on? And that is the concept of pre-patient. Can we provide different routes for the patient to identify these things? And for that, it's really screening. And there you can use a lot of model because it's not a full-on diagnostic. It's just identifying the risk of this patient, if that makes sense.
Yeah, it does. It hits home when the initiative that I ran before, Athletigen, that was what we talked about, is how do we give the athlete insights for prehab instead of rehab, right? So, if you have specific injury markers, injury risk markers that are indicative of injury risk, like there are several well-known documents supporting collagen markers that associate with higher injury rates or higher susceptibility to injury. Interestingly enough, when I surveyed elite athletes who were Olympians and in their mid-20s, I mean, just the fact that you made it that far, well, you've avoided career-ending injuries, right? Like literally, that's why you're there. And actually, what we found was there was like 75% overrepresentation of these injury protective alleles in these elite, performers. Now, still, a number of them were injury vulnerable as it was related to these markers. And the way that they were still able to get Olympic medals is they had coaches who knew that information about them. And so to apply the same kind of terminology, with pharmaceuticals, minimum effective dose, right? Is same thing. Like those coaches were very forward thinking in terms of how they would prescribe training as the minimum effective dose, right? Is what's the minimum amount of training that you need to overreach to get the physiological adaptation to break the world record, right? And so it's like, how do you put in like strategic stress into the system? And we were like Helix, like way ahead of our time. Like we were, proving this out in 2016, like when wearables were just coming to market, and now it's much more feasible. But when you had the right program managers, like the right coaches who are actually bringing in not just the DNA, but different inflammatory markers, let's say in blood, a lot of survey questions, which turned out to be actually very indicative of, or very informative when it came to testing an athlete's readiness, let's say. So yeah, it became this preventative prehab, pre-patient model or protocol, if you will. The thing that is always, I mean, that was kind of the reason that I thought that athletic gym would be such a great idea, is because as I doing, I think I might have just done my PhD so I could be a pseudo athlete, pseudo professional athlete. I was a track athlete, and going to grad school and postdoc allowed me to compete later and later, which, in hindsight probably wasn't the best idea, because I really, accrued all of these injuries. And when I looked at my DNA, I was like, if I knew all these things beforehand, I might have made different decisions. Of course, I say that now after the injuries, but it really was tricky to implement this into a customer journey. Like, an athlete, the only thing they care about is like, I'll do anything just to get another tenth of a second off. And coaches are really struggling with like, well, I'd love to, I'd love to be able to program faster, precision program faster. Like, I don't have time to get my PhD in genetics, right? But now there's all these really interesting front end layers that, as long as you are open and transparent and you can source the science, I think people are, embracing or adopting or integrating these practices more readily, which is why I kind of am advocating for this like model garden, so to speak, where, because I think these we're going to discover more insights, more opportunities or models for the pre-patient experience, let's say, but then also how are we using the existing models today in a more personalized way. So fascinating.
Yeah, and I remember one thing I really liked with you. One thing in general that I think is coming more and more is the concept of a normal range versus an optimal range.
Right. Yeah.
When you get a lab result today, you're within range, but that range is like this big, right?
Yeah.
Within range of what? Which country? Let's start with that, or within range of what age group is this range normal for, right? And I want to know what's Steph Curry's number.
Right. How do I compare to Steph Curry?
How can I compare to what's optimal for me within this range? How can I, especially people that are, interested in their own health, especially it's not much information. They need to really go out and seek a lot of it themselves. The LabCorp result is within normal range. Your doctor tells you you're good. Don't worry about it. Come back when you're out of range. Right. So I think that is coming more and more, and it should come more and more.
Well, I mean, you said it, like, it depends where you are geographically. Those ranges are different just based on, the different health certifying bodies, right? So you're going to have different ranges for healthy BMI, or I had a clinician on the show that was speaking to this exact point, where you could be in one country, cross the border, you could be in range, and then you cross country, you're out of range. So the example I pointed to is one of my favorite evolutionary biologists, Stephen Jay Gould. He had a stomach cancer, and because he's a researcher, so he had that gift of curiosity, right, and the ability to kind of deep dive and understand that his prognosis was maybe 2 years with this diagnosis. But then he said, well, what is that based on? It's like based on the average of people with this diagnosis. And then he started to pull the data apart. He's like, well, some of these people who get this diagnosis are 90, right? I'm 45, and some people are, in a lower socioeconomic class or not as educated. And once he started to kind of tease all that apart, anyway, the point is he had decades of life after that because he just got access to that information. And so now, I'm hearing more and more with, the guests that I'm interviewing is this notion of like a personal LLM, right?
Yeah.
That basically compares you to the appropriate part of the normal curve, right? And but then you're never in a normal curve, right? You kind of collapse that idea. Yeah. Do you have like a digital like roadmap, like to that extent? Do you enable that with other like program leads? Like, do you see, because I know your background is in cloud storage, cloud computing, so I can't see how you stop thinking about data insofar as insight and action
Yeah,
and
yeah. There's two part of our when we think about like we always start with the patient, right? And the number one part for us that is important is how do we move the patient seamlessly through a journey? That is the
Mhm.
most important thing. And the second part is how do we add value during every step, right?
Right,
So
right.
if you think of our pharma programs, pharma spends billions of dollars in advertising in a hope that a patient is going to go and talk to a doctor. The reality is, I think we talked about it in our
Mhm.
last call.
Mhm.
In this journey, and I think come back to the digital part of this because it's sort of married together.
Yep.
You see an ad, and primarily majority of the folks don't interact with that ad. Some of them might go and seek information online, ChatGPT or Google, whatever it is, and then they go to their doctor to ask the doctor a question about a specific drug or brand or condition. Most of the time, their response is, "Hey, no, you don't need to worry about it. Your level is not outside of it, or this is okay. This is." So only a few percentage actually that made it to this point reached the point where they get a lab test and the referral to a specialist. And at the point after that, they get a prescription. A very, very painful conversion. And we published a paper on this earlier in the year with Ipsos on the patient journey. And only 0.08% that sees an ad reaches to research to a prescription. And out of those 0.08% successful one, it takes them anywhere between 3 to 7 months. And the way we sort of think about ourselves right now today is if patient that is educated, sees an ad, online education, disease-specific awareness program, are patients that end up on an island. Today, it is their own challenge to go from this island to talk to a doctor. They need to swim over, and then from the doctor,
Mhm.
they need to swim over to the next island, which is maybe lab testing or maybe. So there is so much hurdle for the patient to go from A to B. And that's what we're trying to solve. There's a picture internally that we use that we're the bridge between these islands, and we
Right.
need to make it as simple as possible. Throughout this journey, each step on each island, the patient has 1,000,001 questions,
Mhm.
which Dr. Google wasn't doing a great job. At least ChatGPT is doing a much, much better job without having all of the information. So I think it is up to us and to any healthcare provider to bring some of that knowledge graph, that digital data, and try to enrich that, keeping it within the guardrails of that topic. We spend a lot of time on creating easy to understand lab result interpretations. We have libraries and libraries on these. We work a lot to try to explain questions that the patient might have prior to the visit, having, I hate to call it, but a co-pilot type of a journey that is specifically tailored to that point so that you can get just ease of mind for that moment instead of going. So I think with this whole data that we stored, with this whole step by step journey that we control, if we could enrich it so that we, number one, educate the patient or help them answer questions prior to a doctor visit or even post doctor visit. Can you explain my telehealth summary to me? I don't know what this means. I think that would help a lot. So, back to your question, yes, we focus a lot on the patient journey, but you need the digital data to enrich that journey, to bridge those gaps.
Mm. Right.
It's
Yeah.
the
It just as
combo that is very valuable.
right. And just as you were explaining that, that made me think that now, like once you've gone through that patient journey, the patient has learned from experience, and in theory, they should have a well, they do have a patient history, but in practice, can we now make that digital? And so then the next time something happens, you kind of have that kind of loop as a bit of experience to draw on, and then it's even faster. And then, maybe you go through 2 or 3 loops, and then you're not going through loops anymore. And that gets you to your kind of pre-patient kind of a outcome. Because nothing is motivating. Nothing is going to motivate you to take control of your health than when you get sick. Mm. And so if you
Yeah.
can build that kind of loop into it, that would be really interesting.
Yeah. And I want to say, yes, we're doing that. We're not, unfortunately.
Mm.
Our journey ends at some point based on the programs that are set up. Somebody else takes. So I haven't really so far seen anything that is good that has that full on, 360 loops. There are some, there's a lot of talk about continuous care, but is it really continuous? Mm.
Mm.
If you if you really do, your annual checkup once a year, if you manage to do that, is that continuous of care, or is a million thing that happens in between?
Mm.
I don't know. I haven't seen a really good one so far. There are some private subscription based ones, but even there, the products are great. It's just the price that the patient drops off at some point.
Right.
I don't know. Another sort of internal joke is it's also like changing the perception on population. Like brushing teeth is something we do every day, twice a day, right? Why can't we think about that when it comes to checkups or my lab results, or that this is something you do every quarter or at least 3 times a year, right? Right now as a society, we're going through the whole phase that, hey, I'm going to brush my teeth prior to my, the dental visit, and I'm going to wait for the next dental visit, and I expect I'm not going to have any problem with my tooth. That's the society we live in when it comes to healthcare.
Yeah. Well, yeah, I think you're onto something with the friction, right? So from the awareness to the conversion of 0.08%, I think you say, in 3 to 7 months, is because there's a lot of friction, there's a lot of barriers. I think there's a lot of like education that needs to happen along the way, because maybe this disease is even a surprise. And I think that's where it does come to what you were talking about, is there some kind of harmonization of the risk. Like, how do you bake that into it? And how does the risk become low friction? And then how does it become a scorecard that you want to keep? Because as you said, it's humans, that's something you don't even challenge anymore. Like my daughter's 2, and she's already brushing her teeth. And so, so I'm teaching that, like, as a parent, and maybe there's something to be said for that. Like, how much of this could start in the home? And,
Yes.
and then, well, like, again, can we have like a family, LLM, and can you have a health wallet that, you bring and is portable and, can be shared with these different programs?
Yeah, and if we find an incentive loop for the
Mm.
population as well, is that an
Mhm.
insurance cost incentive? Hey, you're
Mhm. Mhm.
electric driving, right? You're a reckless driver, you're going to pay a higher premium versus, hey, is there an incentive of not missing disappointments, of
Yeah.
trying to work towards the right direction, financial incentive even?
Yeah. Yeah. Well, like life insurance, like what I'm seeing pop up is, I mean, to me, life insurance would be a great example. That's a win-win, right? Is like, I don't want to cash in on my life insurance policy because that means I'll be dead. So I'd like to live as long as possible, and, create my own wealth, right? Like, I think that's what we would all want. And, obviously the health insurance company doesn't want to pay your claim. So, I'm starting to see things like integrating, again, this is more wellness, but like age clocks, and hey, and can you gamify it? Can you do these things and, check your bloods and do an epigenetic test every quarter? And, the goal is to have your biological age to be less than your chronological, for example. So, yeah, I mean, fascinating what you've been able to do to, basically start from rockets to precision source code of the human body to now reduce the friction and get people the medicine that they need. And then clearly there's a vision for the pre-patient problem, which, is a big nut to crack, that's for sure. But I want to be respectful of your time because I know it's a busy week for you, but I did promise, 3 questions toward the end, and here they are. So if this was your last podcast, what's the critical message we need to get out? And then number 2 is who needs to hear it? And number 3, who would you recommend as next guest?
So, all right, let's start with the first one. If this was my last podcast, I think the message that I would like to get out is don't wait. Don't wait for tomorrow, or whether it's an activity you want to do, whether it's the time with some loved one you want to spend, or whether it is improving your own health, whether it's that lab test you want to take, or whether that's that. So don't wait till tomorrow. Just do it today. Tomorrow might never come. And the sense of urgency, I think one of the reasons behind my personal success is the sense of urgency in everything we do. Even that sort of the gym session that we just postpone day after day, right? Just don't wait for tomorrow. If you have that mentality with everything you do, I think that's one of the messages. If you get that out there, we will be a better society, all in all. The second one was,
who needs to hear it?
So it was, if your message could reach only one person, who would that person be? Oh, that's a tough one. If this message,
this message, yeah,
everybody.
Yeah, it's a trick question, isn't it?
Healthy people.
Yeah. Well, yeah, sure.
I think sometimes when we're sitting in a place where everything is good, we become too comfortable, but time can change. I definitely started looking after my own health much, much more since I became a father. I sort of realized that not only do I need to be, high energy and healthy, not now, but 20, 30 years, I want to be able to do some of these activities that I do with my daughter. I would love to ski with her when she's in her 20s. That means I need to be in a good shape, and also that my joints and things needs to work as well. So yeah, that's a tough one, but I think maybe somebody that needs to hear it more than anything is myself, that I need to. If I start with myself, then maybe I can influence other people.
Amazing.
For the last one, I read this message and I have 2 individuals in mind, and I'll connect you with both of them. You make that decision. One of them is a gentleman named Mariano Bendersky, and he's a innovation. He's part of the Sanofi innovation teams. He sees a lot of stuff AI related for pharma, which I think it would be interesting for your audience. Really interesting gentleman. Had the pleasure of working with you for a while. The other one, as we were talking, is I have a good friend of mine that used to be head of data for Lucid. He's not in healthcare, and he used to suffer, Maysam Jafari, he used to suffer from extremely bad chronic migraines and tried anything and everything, went to see any doctor. And one day he decided to take matter in his hands and just science the hell out of everything that he did, from eating to really solve this migraine problem. So he's his own, clinical trial guinea pig. He's his own. And what's beautiful with him, because he comes from such a heavy data background, he crunches a lot of numbers. He feeds them to ChatGPT. He has prompts that are extremely impressive that he feeds his entire health into this. He's tried everything from, traditional medicine to all of the peptides, to new age medicine, to mental health, to the psilocybins and all of that stuff. And now has significantly improved his health, lost 30 pounds, is in a great shape. So I would he's definitely a patient that managed to take care of his own health himself.
Mm.
I think it would be interesting to hear the story, not just from us trying to offer, solutions to the patients, but from a patient and patient journey themselves. How did you go through it? How did you battle it? What was your mindset? And so on. So I would think he might be an interesting candidate to at least talk to.
Amazing. Well, yeah, I'll definitely take you up on the to reach out to both, and I'll mention our great conversation, and I'll certainly extend the invitation. Um, Jorge, thank you so much for being so generous with your time. Absolute pleasure to have you here today on the show.
Pleasure to be here. Thank you so much, Aaron.
After hearing Pouria, the future is no longer feeling so abstract. It feels near and perhaps a little demanding. We began this conversation with a rocket scientist looking at a single pixel, and we ended with a philosophy of living. You've heard how the friction in our healthcare system, the islands between diagnosis and treatment, costs us time we cannot afford to lose. You've heard why optimal is the only standard that matters and why the average is a dangerous place to hide. But above all, you've heard Poirier's final resounding offering. Don't wait. Don't wait for tomorrow. Evolution in both biology and technology towards immediacy. The organisms that adapt and the systems that survive are the ones that act before the environment forces their hand. So the question now turns to you. What will you do with the horizon you can see now? What engine light have you been ignoring? What anticipatory step can you take today, not next week, not next quarter, to become the future version of yourself you'd be proud to meet? The infrastructure is rising, the tools are ready, and the vision is real. Your task and ours is to help bring it to life, one intentional action at a time. The future of care begins with the courage to begin. I'm Dr. Jeremy Koenig. Until next time, let's keep this conversation going.